Hi, and welcome to this presentation of an assessment of needs of childhood obesity in Hawke's Bay. This is just to show the current situation of childhood obesity in Hawke's Bay and what we aim to do. So the issue is that currently 1 in 5 children in New Zealand are overweight, and 1 in 8 are currently obese, so 12.3% are obese of 2017. This is an increase in numbers from the 2006-7 health survey that showed 1 in 12 New Zealand children were obese, a 4% increase, so really interesting to see that. And the current situation in Hawke's Bay is that 13.2% of children are obese, which is more than the New Zealand rate, the national rates of childhood obesity. So the objectives of this these assessment is to try and understand and then review the complexities of this issue to show how resources can be properly allocated to help decrease this issue, and also kind of show what steps need to be taken so that we can move towards a healthier future for children in New Zealand. So, the setting, Hawke's Bay, in the Hawke's Bay region. It's one of the more poor regions in New Zealand, low socioeconomic status, and high rates of Māori population. So, and a real keen one for if you're trying to look if we're looking at decreasing Māori obesity rates. So the stakeholders in the situation of this issue would be obviously Plumket New Zealand with their relationship towards children and how they work with them, the Ministry of Health, Hawke's Bay District Health Board, Sport Hawke's Bay, local primary schools and childcare centres, so kindergartens and that such. Also high schools to a certain extent, mainly because the age groups we're looking at is 0 to 14, and in New Zealand we start school at about 12, 13, so including them would be also advantageous. Local iwi and hapu, so including Māori in the conversation around how to better this current situation of the issue, and also in the Ministry of Children. So the data that's available for this needs assessment, so we are primarily going to be looking at national regional health surveys, so the current one that's 2016-17 from the national one and also the regional one. The Green Prescription Patient Survey 2016, that showed a lot of positive results for the Green Prescription program, which tried to increase healthiness, which with a specific focus on obesity and overweightness. And they showed positive results in their findings for the Green Prescription program, and also an article that was interesting that showed the successfulness of the Green Prescription program in Taranaki in terms of the effectiveness of with working with children. So the questions for this needs assessment, the main questions: what can be done to assist the families and children most affected by childhood obesity? What initiatives and programs are currently in place to service those most at need, and are they successful? Which that brings in the Green Prescription survey and the article about the effectiveness towards children. And are these services accessible to those most in need? So reaching those lowest income families and just trying to lift them up from their current situation. So the main method for inquiry into this for this needs assessment will be through an appreciative inquiry, which kind of gets everyone, so those main stakeholders, gets everyone and gets them to discuss what positive steps are being taken at the moment, and what can be done towards looking into the future, and what can be done policy wise, and what can be done for the community, and what the dream is, I guess, what the eventual goal is, so that we can aim towards it. For this needs assessment, this will involve using the stakeholders that was previously mentioned. So the stakeholders, Blanket, Ministry of Health, getting them all involved in the conversation around how we can better the current situation and move forward. So gathering information, the main sources of information, so the main people that we're looking towards getting information about the current situation. We Plunket nurses through Plunket New Zealand, paediatric and general practitioner doctors, so family doctors, that would be frontline to most of the childhood obesity alongside the Plunket nurses. Green prescription implementers, so in this case, Sport Hawke's Bay, they have a team that that looks towards that implements the green prescription program, and so gathering their input. Private sector representatives, so mainly from the food industry, what they can add to the into moving forward with this issue. Ministry of Health and Ministry of Children representatives, so what from their perspective can they add to the conversation. Whānau order officials, so getting that Māori perspective on things and kind of getting a Māori view on the whole childhood obesity and family lifestyle kind of things. And then families within the communities that are most affected by childhood obesity. So there's families that have children that are obese and are looking to better themselves, so they can give their input and try and add to that conversation. So how we'll reach these guys, so especially with the families of most affected, so before school checks, so getting them to inform us on what their opinions, their kind of perspective on the whole thing, and then direct appeal to community groups and governmental organisations, so your key stakeholders, and where to reach out to them and through that appreciative inquiry and just kind of ask how they feel about the whole situation. So in analysing what information we get, the researchers of the needs assessment will kind of split themes into public versus private, professional versus those affected directly by the issue. So how different their opinions are on the issue, and then ethnic versus non-ethnic, so how their opinions change looking at that issue. So training will be given to develop proper communication skills in order to gather the proper information, so that they're they're able to communicate effectively to get the most information out of the informants as much as they can. So just getting as much information would be ideal, and then training them up to do that. Then presenting the results. This will primarily be a report for stakeholders. So this will be in-depth reporting on the effectiveness, the key in-depth findings of the needs assessment and what kind of themes and that, and then for the general public, there will be a more simplistic form of reporting through the form of internet and TV coverage over the 3-month period for the general public, so that they'll be able to be informed of the current situation in Hawke's Bay. So the employees, the kind of the key people that will be working within the needs assessment. So we've got the manager, coordinator, and researchers. The manager will be mainly maintaining that the assessment follows the correct timeline. I will go into that in a bit. Organize as much of the personnel, so all coordinator, researchers, organising them. Responsible for the successfulness and completion of the project, and final reporting of the assessment. Then distributing the findings to stakeholders in the community, so what we talked about here. The coordinator will ensure the researchers will undertake all research properly, So this is going back to the training and just making sure that they're doing their best to, so this is the coordinator's responsibility to make sure that the researchers are getting the most information that they can, and the researchers obviously gathering statements and data from these stakeholders and getting out into the community and assessing what this current situation is. So the timetable, it's over like I think it's a 7-month period. 7-month period. Yes, and this will kind of the main bulk of it will be creating those connections and asking the questions. So getting in there. So through the March-April period, that'll be the main kind of gathering of the information, and then presenting the information to stakeholders in the community will be through that June-August period, where they'll be out, where the information will be out to the stakeholders through a report, and then to the community in the form of internet and TV. In critical reflection of this needs assessment, there is involvement of Māori, so like through the iwi and hapu, and getting them their involvement through the whole situation. But other ethnic groups seem to be lacking, as there isn't much of a large group. There aren't large organisations that represent, say, Asian communities as much in the Hawkesbury region, as there isn't a large population, but still getting their voice would be important for future assessments, as New Zealand moves into like a more ethnically diverse country. And as this is a qualitative assessment, there is, and it's more getting comments back from the community and organisations, there is a possibility of bias, so getting resentment from the government not doing much, and the private sector doing too much in the form of like diet and that kind of stuff. So just and not moving towards facts and more towards opinion in this kind of sense skews the results, I guess. But I guess this is what the whole thing is about, that we're looking at people's opinions on the matter and not really looking at the facts. But I guess, yeah, it's a bit difficult to talk about. So that is the needs assessment for this for childhood obesity in Hawke's Bay. I hope you enjoyed it. Thank you very much again.